welcome to another episode of Community Storytelling, second season. Linda Lester, Lester Square, thank you so much for giving us the opportunity to have this show. And Jayco's Art House in Los Gatos, love the canvases behind us. And now I get to introduce you to one of my friends, and she's probably your friend too, because I think she's everybody's friend. And if she's not your friend, you say she is. Gay Crawford. Gay Crawford. I've never had an opportunity to just sit next to you and interview and be serious for a moment.
Well, it's a pleasure to be with my old friend, Lissa Kreisler. We've probably known each other 40 years.
I know, when we were just like
Girls.
10 years old, something like that. Yeah, well, we were both in the media business.
Yes.
You were actually a journalist. I guess I was too. I just never acted like one. You went to Cal.
Yes.
And then you became a media consultant.
Well, I had a few jobs along the way. I did everything from work for the Oakland Tribune, United Way, Pacific Gas and Electric. But my favorite all-time job was, of course, at KNTV as Community Relations Director.
And I think that's how we got to know each other
Yes.
way back when.
Yes.
So people don't really know you as media consultant anymore, although you still do it because I sit on committees with you and you're, okay, how do we get this coverage and who do we get here and how do we get this person to listen? But everybody knows you as a helper, somebody who gets you through something very tough in life, which you've experienced twice?
Several times, yes.
Cancer survivor.
It is interesting because I think probably it's partially my personality to fight like a dog to make change or make things happen.
You do it well. Nobody does it better.
And whether it's a pothole in the road or in my case, I think my category really for Rotary, for instance, it has been media consultant. But most people know me as a health advocate and particularly with cancer because that has been my experience. And I've been blessed to know some of the best physicians in the world, truly. And so when people have trouble, and I've had calls from Germany and France and people I don't know, friends of friends who need help. I had one today that really wanted to access hospice. And as part of my cancer journey, I had the pleasure of meeting wonderful Los Gatos Jenny Magid. And Jenny had a vision for a hospice. And really, there was only the Marin Hospice in California. There was one in Connecticut. And we called ourselves Project Journey. And we met at homes and eventually got Roy Strasburger from St. Andrews involved and Dr. Bob Reed of Los Gatos and came up with the name Hospice of the Valley. And it was really the second hospice in California, nonprofit hospice.
No, it will. I did not realize, though, that you were connected, that you were one of the founders of it.
Yes.
That was something new for me to find out.
It was Project Journey in those early days.
Let's go back to Gay Crawford.
Oh, gee.
I want to talk about Gay Crawford. So you were diagnosed, I believe, with cancer in 1974?
Yes.
Breast cancer?
Mm-hmm.
How long did your journey take before you were a survivor?
Well, it took about 5 minutes to get involved with the American Cancer Society because I had a visitor. The American Cancer Society has a program called Reach to Recovery. And a woman came, in those days you stayed in the hospital 2 or 3 days, and she came to the hospital and she was an elderly woman and they had a brochure with sort of an elderly woman in a bathing cap, and I couldn't relate to it. I was 30 years old, and of course everyone asks you to fill out an evaluation, which I do religiously everywhere I go. And I said, you are not addressing the younger population, and some of us who are younger getting breast cancer. So,
and you were young, 30.
I was young. I was probably, no one in this area had the same diagnosis, so I ended up visiting all the hospitals, all 14 in Santa Clara County, meeting women, young women. Usually I would just visit the younger women, but none
While
were
you yourself were dealing with cancer?
Well, the American Cancer Society has a rule, and I think it's a very good one. You're usually asked to wait a year following your diagnosis and treatment, and in those days it was mastectomy. There was no chemotherapy even, or so I waited a little less than a year and went through the training and became a certified visitor, and then of course went on to be involved in everything with the American Cancer Society and on their state board and even their National Research Council.
And this is all happening while you yourself are trying to get well.
Well, yeah, I think some of us get well in different ways, and I
Yes.
think my way of probably dealing with it was trying to help others. But you do have to address it for yourself. And I had a 2-year-old and a baby at home, so it wasn't easy. But the involvement with the American Cancer Society was really meaningful in those days, and so I enjoyed the research part of it too in more recent years.
And you never stopped. That was just the start. That was the start. I mean, you are a tireless advocate for anybody dealing with cancer, whether it's the patient, the spouse, the children, the parents, I mean, the friends. You are there for everybody.
Well, thank you. I do think it will be my legacy if there is one, and I'm proud of that because I think I have been able, you know, if you live long enough, you learn stuff, and I've been blessed to live long enough and see the gaps in care. So founding hospice and learning from George Fisher that colon cancer is a curable cancer if you get the right test, colonoscopy. So I bit into that one, and I even played Polyp Man in the Los Gatos Parade. Do you believe it? The actor wasn't available, and I was like, I could do it.
Well, wasn't there some sort of an event in Los Gatos, colon cancer-free zone?
Yes.
When was that? What was that about?
So after Dr. George Fisher at Stanford told me that colonoscopy can actually prevent colon cancer, I thought, we don't have that with other cancers. I mean, we cannot prevent breast cancer. People talk about cancer prevention, but skin cancer, colon cancer, there are very few where you can take preventive measures. And so a Dr. Richard Adruni from Monteserino came up with the idea. He said, it's a little kooky, but how about we declare areas colon cancer-free zones? So actually, Los Gatos was one of the first. Monteserino was actually first. Los Gatos, Saratoga. Then Kathleen King from Saratoga got the Santa Clara County involved. Basically, it's a media event. You understand it.
I've heard of
Tell
those.
people that you can prevent colon cancer by getting appropriate testing. And by declaring themselves colon cancer-free zones, these cities, which everyone in Santa Clara County did eventually declare themselves colon cancer-free zones, they were able to endorse media stuff, publicity, talk about the actual screening techniques.
But you said colonoscopies can help prevent cancer. To me, that doesn't really make sense. You get a colonoscopy to see if you have colon cancer.
Colonoscopies will detect polyps
Right.
that are precancerous. So if they can snip them at the precancerous stage, you can prevent colon cancer. Sigmoidoscopy is, of course, just part of the colon, and I don't know, this is group audiences.
that's
maybe
okay.
they can't talk about this stuff, but it's extremely important, and there's some new tests that aren't
I think I've had 8 of them already.
8 of them.
And
So-
I'm still fairly young.
Yeah, and you
So-
should have it by age 50, and if you have it in your family, you get it before. And,
Yes.
and I would say demand a colonoscopy if you can, if your insurance will pay for it. And my brother said something about, oh, I can't have one because my insurance won't pay for it. Excuse me, if you are at risk, then you get it.
Yes.
You get the test.
And you somehow pay for it.
Yes,
I
you
always
figure it
said,
out.
even if I didn't have coverage for a mammogram, I pay for it.
Yeah, and we fought for those in the early days. I don't know if you remember. You were on a media committee.
Yes.
And Cortese's, what was her name?
Mary Liz.
Her father, I believe, Dominic
Dominic, who I recently saw and looks fabulous.
fought the insurance
Yes.
industry because at one time mammograms were not covered. So part of my story is advocacy, and some
Awesome.
of it is, healthcare and advocating for patients. But legislation has made a difference in cancer care.
Now, something I know is very near and dear to your heart, and we've actually had several people sitting in this chair talking about the very same organization. And I'm glad, because I'm glad that the word is getting out, Cancer CAREpoint. You brought me in on that several years ago when we were a piece of
Girls again.
paper. It was a piece of paper. It's come a long way.
Cancer CAREpoint is probably, and I'm proud of having founded hospice.
Well,
but
you should be.
Hospice is now, a big $15 million organization. Cancer CAREpoint is so local and so caring, and I'm proud of the staff. I'm proud of the work that has happened there. I mean, it's non-medical support. Sometimes it's hard to explain exactly what Cancer CAREpoint does. One of my best things I did, and it took a long time, but I approached the hospital council and went to every CEO of hospitals in Santa Clara County and some in San Mateo and asked them to endorse the sort of psychosocial non-medical support for cancer patients. And indeed, they all probably do in their own way, but Cancer CAREpoint is unique in that it's independent. You don't have to go to your hospital to talk to a social worker.
You don't have to have a referral.
You don't have to have a referral. It is all free, and it's just an amazing service. The wig bank, the exercise, the nutrition classes are wonderful, I think every Monday.
Yes, and just walking in the front door gives you, I believe, and thank God I don't have to know it personally, but gives you a sense of relief.
It does.
Sense of help. There's a smile waiting for you right away.
This is my refuge. They'll walk in, and it is a warm, we have tea, we have a nice room where people can have support groups.
There's a fake fireplace.
There's a fake fireplace. I wondered who's paying for this.
There's blankets all over. It's wonderful.
People participate. Yeah.
So you have got a long list of awards. Now, there's the Jefferson Award, there's the Women of Influence from the Business Journal, the list goes on, but there's a new one.
There is.
And I want you to tell us about it.
Oh, right.
Because it's quite an honor.
It is a huge honor. It's a national honor for being, I guess, the patient advocate.
For being gay Crawford.
2018.
It's a national honor just for you.
And it will be given in Washington, D.C.
And it's
on
called?
November 14th. It's the Ellen Stovall Patient Advocate Award, and it's from the National Center of Cancer Survivors. And this award has been around for maybe 2 or 3 years. I didn't know anything about it, and our wonderful executive director, Rob Tufels, insisted that I be nominated. I mean, he had the information from the Healthcare Heroes and all these other wonderful, wonderful nominations.
Well, congratulations.
So,
Nobody
you.
deserves it more than you do.
Thank you. And there are some lovely letters that people wrote, either as patients or doctors, about my work, and that's special.
And another special thing that you've done. You created, I think it's maybe almost 30 years ago, Courageous Kids.
That's what we're here to talk about.
What is that? No, I just want to mention it because
Yeah.
it is amazing what you do every year at Great America. Tell us about it. And how did it even get started? Because again, you had this vision of what people need.
So I was a young breast cancer survivor, as we've said, and volunteering at the American Cancer Society. And my boss at Channel 11
Could that have been Stu Parks?
No, this was, well, Stu was working there, but their son was diagnosed with leukemia. And I went through that journey with him. And I looked around at the American Cancer Society and I said, there are no services for children here. Okay, let's do something. And because of this wonderful network I have, people like Brian Adams and people, there was someone from Great America, and they said, let's have a picnic. Why not? And someone else said, well, let's take a family portrait of these people. And truly, the format has remained the same over 30 years. We've gone from maybe 10 volunteers putting it on to 200. We serve about 500 kids with cancer and their families every year. So there's probably 2,500 people in the picnic grove on Mother's Day. And 30 years, I'm very excited. We want to do something really different. This last year, we had a cancer researcher come, Dr. Shannon from UCSF, to talk to the kids and talk about pediatric cancer research. So
it is an amazing day.
It is.
Brings a lot of happiness.
And people say, oh, I don't know if I could volunteer. It must be depressing. It is not depressing.
Not depressing at all.
These kids come with joy. They come with their families, and they're sharing with one another. Some of them know each other from their hospitals. think we have 13 treatment centers that send children, and all over California, Northern California, Southern California, they know about Courageous Kids Day. And so, yes, I'm very proud of that.
So looking back at everything you've done, would you make any changes? You know, I mean, 40 years later, after being a cancer survivor, you know something now that you didn't know back then, or things that you wish for people who are watching us right now, who are going through what you went through at one point. Any advice, any words of wisdom, anything that got you through a day that helped?
I think part of what I'm thinking about, even with this national award, it's like, what now? What are you going to do now, Gay? Where is your passion? I see a lot with palliative care and the right to die law. I mean, that's a heavy subject for an afternoon show, but I do think we can do more with that. I had a reporter call me and say she couldn't find any doctors who would talk to her about it, even though they might have done it. Anyway, it's become a really difficult subject, I think, but one I think should have choice more involved. So whether that's something I would want to spend more time on, I'm thinking about it.
I don't know if you have any more time. How many grandchildren do you have now?
So we have 4 boys.
Yes.
4 precious grand boys, and 2 are in the Southern California and 2 in San Francisco.
And when you're with them, you're a crazy grandma.
I am.
You do the
crazy.
silliest things.
I can be silly.
Yeah.
Just saying, went to Raging Waters. What was I thinking?
Not only did you go to Raging Waters, you went down the slides.
I went down the slide.
I wouldn't even do that.
One slide.
That
and
was
then
it.
there's the lazy river. That was pretty easy. But yeah, no, we like to do fun things. And my Northern California kids are very, very busy. The parents, my daughter is founder and CEO of her own Alzheimer's research firm, and she just raised, I think, $77 million to try to cure Alzheimer's.
Where did she learn all that from?
I have no idea.
Yeah.
So she's very, very busy, so we get to spend a little more time with the Northern California kids than we do Southern California.
I mean, I'm just tired listening to you. I mean,
I do tire people.
What do you do for fun?
I do for
besides being with the grandkids?
I
know
do
you
like to garden.
You like reality TV.
Oh dear.
Don't
yes,
get me
it's
started.
True. And I have been known to play Candy Crush and Cookie Jam, and had somebody the other day say, haha, I passed you on, I think it was Candy Crush. And I'm on like level, I don't know, 1,000 or something.
I've never played once.
No, good
never
for you.
Played
Don't
once.
ever do it. Yes, and I do like
I
a little
eat the
reality.
candy. I don't crush it. I just like to eat it. And what,
So, and gardening.
And gardening. I mean, you know, I feel you do so much for the community. What can we be doing for you?
Oh gosh, just this. You know, somebody said, when Gay asks you to do something,
We do
you
it.
can't say no. George Fisher said that. And I was really touched, because I think that shows I've built some credibility over the years with friends and people who can do. I mean, I used to ask you to do radio interviews, and you always were there for us.
So a word to the wise, if you ever get an email from Gay and you haven't heard from her for a while, say to yourself, I'm not looking at this, because it means she needs me for something. And nobody ever says no to Gay.
No.
Nobody ever says no to Gay.
Yes.
And thank you for not saying no to us today, because
Well,
I really wanted you to be here.
Thank you for having me.
You are the most exceptional person. You deserve every award and accolade you get, and you deserve a big thank you from this valley for all you've done to make our lives better.
You're touching me.
Oh my
Thank
goodness.
you.
Oh. Gay Crawford, how many stories did you just hear from her? Everybody's got a story. What is yours? KCAT.org. Nominate yourself, a bestie, somebody you know, somebody like Gay, because we would love to have you or them sitting right where she is. And as always, I appreciate you so much for being with us today at KCAT TV 15.